State lawmakers are responding tonight to uncertainty over federal Medicaid funding that Wisconsin relies on to cover more than half the cost of residents here receiving care.
It could also impact the debate and the passing of the state's biennial budget. It's due by July 1st. House Republicans unveiled the cost-saving centerpiece of President Trump's legislation late on Sunday with at least $880 billion in cuts, largely to Medicaid to help cover the cost of $4.5 trillion in tax breaks. Republicans say this is meant to eliminate waste, fraud, and abuse to generate savings with new work and eligibility requirements, but Democrats believe millions of Americans will lose coverage as a result.
Jason Timmerman has been speaking with both sides of the aisle and local Medicaid providers. He's live in our Fox Valley Newsroom with details on that. Jason.
Bill, the impact this could have on Wisconsin is still up in the air. Tonight, lawmakers tell me they're watching the debate in the nation's capital closely, knowing any cuts to Medicaid will have to be made up at the local level. As state lawmakers debate the biennial budget, Medicaid is now a top concern. And if federal funding drops, those who provide care, like the Partnership Community Health Center with offices in the Fox Valley, are expecting the worst.
This would be a big hit for us.
Right now, the partnership serves 17,000 clients, and 70% are on Medicaid.
1 out of every 6 Wisconsinites is on Medicaid, and when we think about that, that's somebody we know. There are 3 out of 5 children, and a majority of the people live in rural areas.
Democrats like Representative Lee Snodgrass say whatever is decided at the federal level must be considered in crafting the upcoming biennial state budget.
People always reference the budget surplus, but I'm here to tell you that that budget surplus is not going to cover the kind of reductions we would see with Medicaid. Backup plan is we're going to have to do at least something to fund it.
Over the weekend, the Republican co-chairs of the Joint Finance Committee were also asked about the potential loss of Medicaid funding during an interview with Upfront.
We don't know what's going to happen yet. I mean, and Mark and I don't have any inside information as to what's going on in D.C. So
that's for sure.
we're just gonna wait and see. You know, we've always based our budget decisions on the best available information. And
those who depend on Medicaid also speaking out.
You know, it's like, okay, this is an easy way to save money. Let's save money on this. But if the roles were reversed and they had a child with disabilities, or their mother was older and not in good health and needed that, maybe they would have a different outlook on it.
It's estimated about 54% of the state's Medicare funding comes from the federal government, according to Wisconsin's nonpartisan Legislative Reference Bureau. Reporting live in the Fox Valley News from Jason Zimmerman, Action 2 News.